Today, we are going to briefly introduce you to the anatomy relevant to the ClearPath Nasal Balloon system. The goal of this video is to outline the basics of a CT scan, the anatomy of the septum, surrounding bone, and cartilage. We will then walk you through the main benefits of the ClearPath Nasal Balloon and showcase a surgical demonstration. This is a CT scan of the nose and sinuses. By convention, air is black, bone is white, and soft tissues like the eye, brain, and tongue are gray. As we review these scans, it is important to know the type of view we are discussing. The first view is the profile view, which is the sagittal view. The next view is the axial view, or the top-down view. And the last view is the coronal view, which is the front-to-back view. Please note on the axial and coronal views, the patient's left is on the right side of the screen. The first view is the axial view. Notice that the majority of the nose that is projecting from the face has very little bone. The septum is shown here in this clip. Please take note of its location on the coronal and axial views. The septum extends directly back from the tip of the nose to the nasal pharynx. Notice that the interior most septum is made of cartilage, which then transitions to the bony septum. The nasal pharynx is the uppermost extent of the throat and is where the septum ends. The nasal sinuses appear as air or fluid-filled spaces on either side of the lateral walls of the nose. The superior septum extends all the way to the face of the sphenoid sinuses. Please note the position of the maxillary, frontal, ethmoid, and sphenoid sinuses in relation to the septum. Along the floor of the nose is a pair of cigar-shaped structures that come off of the maxillary bones. These are called inferior turbinates, and they parallel the floor of the nose. Superior to this is the pair of middle turbinate, which originate in the ethmoid bones of the lateral nasal wall. The superior turbinates sit slightly above and behind the middle turbinates. The middle and superior turbinates are important because they are at the level at which it is possible to damage the eye. The ClearPath balloon protects these structures when properly utilized. Other balloon systems do not offer this level of protection. Now, we will shift to the coronal views. This view most closely approximates what you will see during endoscopy. The cartilage section of the septum is sometimes called the quadrangular cartilage. It sits in a groove that is called the Vomarian maxillary groove. As you move backwards through the septum, you'll notice that the bone comes in from superiorly and inferiorly. As you move posteriorly, the superior portion of the septum is called the perpendicular plate of the ethmoid. The perpendicular plate of the ethmoid attaches to the cribriform plate. This is one of the thinnest portions of the bone between the brain and the nose. Moving the cribriform plate can result in CSF leakage. The section of bone next to the sinuses around the eyes is called the lamina papyracea. The fontanelle is a soft area of the lateral nasal wall next to the maxillary sinus. Please note the placement of both the lamina papyracea and fontanelle. Given their minimal thickness and proximity to the eye, it is essential to maintain complete control of nasal balloons. Unintended displacement of a nasal balloon can result in damage to these structures. Now, we will look at some of the advantages of the ClearPath Nasal Balloon system. More benefits can be found at clearpathnasal.com. The ClearPath Nasal Balloon is designed for efficiency, patient safety, and comfort. With a 4-to-1 mechanical advantage, it amplifies force with minimal input, making septal realignment more effective and controlled. The design of the balloon and spatula allows surgeons to gracefully move turbinates, cartilage, and bone. The end of the spatula secures the distal tip, ensuring precise control even in tight anatomical spaces. Most importantly, the device protects surrounding structures, safeguarding adjacent cartilage and mucosa to minimize the risk of unintended damage, as previously discussed in this video. We will lastly look at a brief surgical demonstration of the device. Please see our website for the full demonstration. The septum and inferior turbinates are outlined. Please note the position of the device is for reference only and is not an exact position. As you can see in the side-by-side comparison, the ClearPath nasal balloon system allowed the surgeon to create sufficient spacing in the nasal passage. The ClearPath system offers surgeons control, efficiency, and lasting results for patients. To learn more about ClearPath, visit clearpathnasal.com.